Well, joining us now is another one of Weezie's Angels. It is Sam Merchant from University Health System. How are you, Sam? And congratulations.
Thank you so much, Michael. I'm doing amazing. Thank you for asking. How are you doing?
I'm doing very well. All right. I mean, this is just, to think we've been into this about 6, 7 months, and you were definitely on the front lines. How would you describe this to somebody, all the COVID-19?
Yeah, I mean, it was, and it sometimes still remains scary because you still don't know. There's this fear of unknown, right? The policies and guidelines are changing literally daily to weekly. So keeping up with all that, but on top of that, maintaining safety of the staff, maintaining safety of the patients, and the general public is paramount important. So it was scary and it was difficult to say the least. But at the same time, I think the silver lining is you always have to look at the positive side. So as scary as it was, there was teamwork. Everybody was there to support each other, and that actually what did not feel as scary as it should have been.
Well, safety in numbers, basically. And you had folks to kind of rely on, right? Somebody watching your back.
Exactly. And that is always a key when it comes to safety, right? We know that it's not a one-person job. It requires a village. I mean, we knew, I mean, to get people to wear masks, it did require a village to make that happen. So, and same thing in hospitals, it's a very complex matrix system. So you need everyone's support, not just nurses, but every single one of them, including environmental services staff, to make that happen.
I was just reading in your bio. Did you do everything? Because it seems like you go through the alphabet from A to Z, and you were doing it.
No, I think as we said before, it's always team. You are always a crucial part of the team. As a leader during crisis, people look upon you to be the resource, to be the support, to be the person who will hold the hand and provide hope that things will get better. Even in times when there is no hope identified, right? So it might seem like in the hospital supervisor position, I do have a big hat to fill and wear and get things done. But to me, I think our administration, all the way up to the staff that are getting the frontline work done, all get together to make this happen. So yeah.
Okay, obviously everybody in your position, you're only human, and to do all this, that must kind of be a heavy weight on your shoulders after a while. What do you do to relieve that weight on your shoulders?
To me, I think self-care is key now in healthcare, and it goes without saying that if you don't keep your cup full, then you cannot make anybody else's cup full, right? So to keep that bottle full or cup full, or to keep your uh, thing going, I think it goes back to passion and not forgetting your why. That's my main mantra, my pet peeve. If you don't forget your why, then you know that every time you come across a difficult situation where you know things are weighing you down, you want to give up, you want to give in to the fear, you always think about why you're doing this. Why did you join? For me, why did I join nursing in the first place 15 years ago? But other than that, I think spirituality has a big role to play. So spirituality brings me hope, and that hope can be translated at my work. And so that will be the second thing. And then obviously, trying to just sometimes as simple as getting out of the hospital and getting some sun, it's as simple as that sometimes. But being present, being mindful that your body is asking for that, and leaning into that and saying, okay, let me do this, and then maybe I'll be able to reset is key.
What would you say is maybe one of the toughest moments that you had to go through, one of the saddest moments?
So to me, I think the toughest moment is when initially, and not in our hospital per se, but overall, hearing about lack of PPE, because that's the first safety net for the frontline staff. And so for them not having that and seeing that people were wearing trash bags to support themselves and create that sense of safety was just heartbreaking initially when we were hearing stories from New York and New Jersey. But here, I think when my staff in the hospital started getting sick. That was definitely daunting for me. That was definitely something that was very difficult to swallow. And saddest moment where when we knew there was a young kid who was 23 years old and he passed. And then on top of that, we found out that his mother is in the ICU, a few beds down. I mean, and then his father is in the other side of the hospital. So it's tough when you have situation like that. We had a family where the wife and the husband, we had to put them next to each other in rooms so that they could actually pass together. I mean, it's hard. These are tough things that you have to do, but if you don't do it, who's going to do it, right?
All right. On the flip side of that, I know you can't necessarily call it any happy moments, but the bright spots, moments that made you smile during all this. There has to be some.
Absolutely. I mean, to me, the amount of support that we received from the community was remarkable. I mean, that tells us that we are in this together, and that was not just a hashtag; it was the truth. And here in San Antonio, every single business, every single industry supported us like never before. People realized what nursing is all about and what healthcare and frontline staff are doing, and those things really kept us going. That we can do better, we can still keep doing better. And then when we would find out that, hey, this patient was there for a month and now he's getting better, or he's now extubated, that is, the tube is out now, and hey, he's getting discharged, or this was like our first discharge at the hospital. I mean, those really were moments that made you feel like there is light at the end of the tunnel.
And just knowing that, like you said, that the public knows you're out there, you're doing your job, and you're getting that recognition that you do, and like this recognition as well.
Yeah, this was unexpected to me. You know how we as nurses always are born and brought up that way. Like, you just do the job. I mean, this is what you do. I mean, you save lives and you come back and you do more again, and you keep doing it until you are done doing it, and then you need to figure out what else you need to do, right? So you never stop being a nurse, whether you're at home or you're in the hospital. So for this recognition, definitely puts the cherry on the top. And the recognition does make you feel more valued and feel like the worthwhile work and the joyful work that you do every day is recognized.
Wonderful. Congratulations, sir.
Thank you, Michael.